get Medicare to pay for services, we will legally do that. I mean, we would be foolish.
Is it legal though? Because
Well,
I mean,
we won't do anything. I mean, if the Commonwealth says it's illegal and somebody demonstrates to us it's not legal, we won't do it. So what we will do is to use the opportunities to the extent that we can to have the Commonwealth pay for services. And I mean, you can argue it's cost shifting or not cost shifting, but what I'd say is the burden has more heavily fallen on the shoulders of the state governments and the state taxpayers in current times than it used to be, than it was in the past. And so we're trying to put as much of that burden back onto the Commonwealth's shoulders.
Can we just explore though just how it is that you're doing these radiology and pathology services, which up until say midway through last year or whenever, if you wanted an X-ray, for example, in the QEH or Modbury or the RAH, then you had your X-ray there. But now patients are being asked to sign bulk billing forms for those services, despite them occurring within your state-funded public hospital. And by signing that bulk billing form and using a private specialist provider number, then you shift the cost of that to the federal government. I mean, the federal government going to put up with that?
Well, other states have been doing this for years. Most of the outpatient services, for example, in New South Wales and Victoria, are funded through Medicare. We funded all or most of it internally in South Australia. We're very, as a state, we have been very slow at optimising the Medicare benefits that can flow into our system. So we're trying to do that. I mean, as you just go back to your first point, we're spending about 30% of our state budget on health, and it's growing dramatically. We have to look at every avenue to reduce that cost pressure on our state budget. And there are opportunities to have the Commonwealth fund services through our system quite legitimately and under the rules, and we're exploring every single opportunity to try and make our state dollars go
But those rules are interesting. I mean, if we go back to that example I just mentioned, the patient is asked to sign a form, so it's bulk billed through the private specialists who work in public hospitals using their provider number. Now, the money, by definition, would go to that private specialist, but the specialists are being asked to sign a form that authorises the payment of that to a trust fund that exists within the hospital.
Well, they're the arrangements.
How does that work?
Well, we have arrangements in place with specialists, with doctors who work in hospitals, so they can do private work as well as public work. And under the arrangements, EB arrangements we have with them, they're entitled to keep a certain percentage of that, and then a certain other percentage goes into a fund which can be used for other purposes in the health system. So all that's part of the EB arrangements that we have with the doctors.
But who monitors that fund? I mean, if the money goes into a trust fund...
Well, all the funds go through whatever the appropriate scrutiny. I mean, it's all properly monitored. It's not a hidden fund.
But is it monitored within your budget, or does it sit outside your budget? Because as the federal money flies diverted by the specialist to a trust fund...
well, you're perhaps asking me questions of technical accounting that I'm not really able to answer off the top of my head, but I can certainly find the information out for you.
I spoke recently to the National Coordinator of the Australian Society of Orthopaedic Surgeons. He said that this new system that you have in place in South Australia reflects, as you say, emerging trends in other states, but that South Australia had written a textbook of how to do it.
Oh, that's good. I'm pleased that we've set the benchmark.
His concern, though, was what happens if the federal government or the CEO of Medicare or even the Australian Taxation Office jack up with the legality of those arrangements. Does that set back your budget, or is this all happening outside your budget line, is what I was getting at?
Well, put it to you this way. We have a budget which is $4.7 billion, and we have some savings targets that we have to meet, which Treasury's imposed upon us. I think it's about $120 million this year, and there's a range of things we're doing to reach those targets, and those kinds of measures are part of what we need to do.
It, yeah.
So if we don't meet the target, then we won't meet the target.
So if the
Well, I
federal,
mean,
if the federal agencies say
But
enough of this, then
if they say that, we'll have to.
then
think
you're
of
behind
other
the eight ball.
We have to think of other things to do. But I mean, they are at the margins. They're not. You know, we're not talking billions here. I mean, we're talking millions, but we're not talking billions. But we will try. We just have to make the dollar go further. So we have to make our system as efficient as we can. We've had to put more money in ourselves as a state, and we believe that the Commonwealth should put more funding in. They've agreed to do that through the arrangements we've got, but there are also opportunities there through the existing arrangements which we haven't exploited as efficiently as other states have, and that's what we're trying to do.